Hi my beauties, welcome back to Younger. Today I'm going to be talking about body skincare treatments and different products that we can use on the body skin. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who may find it useful. So the reason why I wanted to talk about skincare for the body skin is because I had a darling patient today ask me to make a video on it, and I thought that it is a good idea to concentrate on skincare products for the body, whether it's the arms, the legs, the back, the abdomen, the chest, because this is a different area than we're usually focused on, usually the face, the neck, décolleté, and even the hands sometimes, but we never really talk about skincare products, cleansers, emollients, hydrators, and different products that we can use on the body. So I first just want to break it down with cleansers and hydrators and other advanced treatments that may be more medical grade, but also over-the-counter treatments that are just simple things that we can do to make sure that our skin on our body looks good. So first and foremost, I want to describe the skin on the arms and legs and abdomen and the non-face areas of the body and how that differs from the skin on the face. So you know how I always mention that it's not a good idea to use oils or heavy emollients or anything containing a lot of oil on the skin on the face because there's a high density of sebaceous glands in the skin on the face, and that can cause dilated pores, texture irregularities, and blackheads. If you think about it, you never really see dilated pores on your abdomen or your arms or your booty or your leg skin, and that's because the density of sebaceous glands is diminished in those areas, and the structural components of the skin on the back or the arms and the legs look very different histologically under the microscope on the face. As a matter of fact, when interviewing for dermatology residency, one of the questions was to look under the microscope and state, is this skin from the back? Is it from the arms, the legs, the face? Just looking at the histology and the cellular components and a molecular configuration of the skin under the microscope, they look very, very different. So that's why treatments that may be okay to use on the legs aren't okay to use on the face, because it would be too greasy, too oily, it would clog pores and that kind of thing. So I kind of wanted to just first and foremost state that there is a difference histologically of the skin in these different areas, and that's why we can treat them differently. So starting with cleansers, and I have a couple products here that I just grabbed from my shower, so this is what I use. For cleansing, it's always better to use liquid cleansers in the shower. So when you're using bar soaps, what happens with bar soaps is they're a solid component, and then with water and an increase in temperature, it kind of emulsifies and becomes liquid form. And then you wash your skin with it, and then after you get out of the shower, you almost have like a film of like a solid powdery kind of mass on your skin, and it can clog your pores. So things like keratosis pilaris, those little bumps that you get on the back of your arms, we always say avoid bar soaps, because once the bar soap gets into the liquid form, gets put on the skin, it resolidifies inside the pores. It can clog the little vellus hairs and pores and follicles on the skin, which can create inflammation, keratosis pilaris, lumpy, bumpy kind of irregularities. So always use a liquid cleanser. You can use it with like a loofah or some type of scrub, or just a washcloth is fine too, or just your hands, but cleansers are best. I like the Aveeno cleanser because it has colloidal oatmeal in it. It's very hydrating. Colloidal oatmeal, ceramides, AHAs, GAGs, these all contain hydrators and humectants that are going to keep the moisture in the skin during your shower and then even after you get out of the shower and pat dry off. So I also wanted to show what I had in my bathroom. So when I'm using drugstore products, which I use on my body as well, CeraVe, this is a moisturizing cream, and I love using this on my body, especially during like the fall and winter months, because it just seals in the moisture. It's best when you get out of the shower to not completely dry off, and that sounds kind of counterintuitive, but just getting out of the shower and kind of pat drying off and then sealing in that hydration and that water in the skin by putting your hydrators on immediately after the shower before you walk out of the bathroom and the steam and the water content of the air gets depleted. It's better to hydrate and put on your moisturizers and hydrators immediately after the shower before you walk out. So I like this. Creams are always a little bit more hydrating than lotions, because creams have a more lipid soluble content, and lotions are just a powder in water solution, and creams are more a water in oil solution. So it just kind of is more hydrating, and it's okay to use on your body skin as well. So if you wanted something a little bit lighter, or you wanted something to help with kind of texturization of the skin so you don't have like crepey, wrinkly skin, this amlactin is one of my favorite over-the-counter products. It's actually probably the biggest bang for your buck because it's not expensive. It's maybe $10 to $12, and you can use it immediately after the shower, and it's an AHA, so an alpha hydroxy acid. It has ammonium lactate in it, and what that does is it actually paradoxically hydrates your skin, but it actually increases cellular renewal and cellular turnover, and it stimulates collagen as well. So this is a great product to buy if you want to stick with over the counter. Sometimes if you put it on immediately after shaving your legs, it can sting, but just for like a minute or two, and then it goes away, and it's definitely worth it. But if you want to use it maybe in the morning when you wake up, if you shower or shave your legs at night, you could figure it out with your schedule what works best. But sometimes I just kind of grin and bear it and put it on after shaving my legs, and it's worth it. There's also a soothing option of amlactin that supposedly doesn't sting as much, but I haven't used that one. But this is a really great AHA, which is going to hydrate the skin, increase cellular renewal, cellular turnover, and have a little bit of tightening effect in the crepey skin. Like if people have crepey skin on their arms, a lot of my patients who play tennis or ride horses or they're outdoors or on the beach will always complain of crepey arm skin. This is one of the best things that they can use over the counter. So moving along, I'm going to go more into medical grade. If you're going to spend the money and you want to use a higher medical grade body care products, I really like the Zeo Skin Health Body Emulsion Plus. So you don't need that much to put on your arms and your legs, you know, your abdomen, your chest, your booty, everywhere else. And it's best to use it again right after the shower. But this helps have a tightening effect on the skin as much as a topical can. So of course, nothing's going to touch the results of a laser or an energy-based device. But for the Body Emulsion Plus is a really, really great medical grade. If you want to just, you know, save your money and use it once a week and then kind of rotate in other over-the-counters, that's another good idea that you can do as well. And then we have the Cellulite Control Body Smoothing Cream by Zeo Skin Health. This one is also great with not only skin tightening, but kind of evening out texture irregularities from cellulite. Now, I'll do a whole different video on cellulite itself, but what happens with cellulite is you have these fibroconnective tissue bands that kind of tether the skin down. And when you can use products that kind of loosen that up and tighten the skin on top, that gives you the best results with, you know, a smoother contour and less of those texture irregularities. And this is the medical grade cellulite cream that I like a lot and I use myself. And moving on, these are two other really amazing products. Okay, I'm going to start with talking about the Revision Body Firm. So Revision Body Firm works on the extracellular matrix, and what that is, extracellular matrix, or ECM, is just the space between the cells in the skin. So that's where all of your collagen production is, your elastin production, and there's a lot of other molecules, humectants, natural humectants, enzymes, cytokines, all these things that are existing in between the cells. And this body cream actually stimulates collagen and helps improve the health of the extracellular matrix. And so when you look on ultrasound and people who are using this product, and that's why I like medical grade, because they always do experiments and prove their data and the results with actual histology, electron microscopy, and other scientific studies that really show that they're having a change in their skin, which means a lot to me. So when you increase the capacity of the extracellular matrix, it basically makes the skin go from kind of wavy and textured to more plump and smooth. And so that's what it does inside the skin once it passes through the dermis, through the epidermis into the dermis. And because of that, the skin can have like a smoother contour. Again, these over-the-counter or topical or medical grade products that are just creams and lotions aren't going to have the effect as like a tightening device would, but they're less expensive and they can actually help out a lot, and you can use them in conjunction with getting treatments, or maybe if it's not in your budget to have these medical grade treatments with these lasers and tightening devices, you can use these products alone. So this is probably one of my favorites. And this is a newer one too. So the Elastin Transform Body Treatment has the Trihex technology. So this is super dope because this has stimulating collagen, stimulating elastin, and other components in the dermis that's going to tighten the skin and decrease the adipocytes. So the adipocytes are the fat cells in the skin, and it increases lipolysis. Lipo in medicine means fat, and lysis means eliminating or cutting out of. So lipolysis is when the fat cells decrease, and they do this by measuring fatty acid content in the bloodstream after using this. So you know that the fat is getting degraded, which is amazing, because if there is an issue with cellulite, or if there's an issue with skin laxity, you know, if you're older, it's usually more skin laxity. If you're younger, it's more fatty and cellulite that you're trying to remove. It does both. And so this is a pretty new product, but it's gotten a lot of published literature, and a lot of my colleagues are seeing great results with their patients. I use it. I love it. I think it's amazing. And what this does is it helps tighten skin for the lax skin, and it also helps decrease fat in areas where there may be a little bit more cellulite, or if you want a little bit more slimming effect. It also has that Trihex technology that I just mentioned, and what that does is it's kind of out with the old, in with the new. So out with the old, all the damaged, degraded collagen and broken up elastin fibrils that have, you know, seen too much sun and has undergone a lot of sun damage, it kind of clears that out. It also decreases the activity of something called the matrix metalloproteinase enzyme. What that is matrix metalloproteinases come and chew up all your collagen and elastin when you have a lot of sun exposure, and so decreasing the activity of that enzyme, which gets upregulated in skin cancer and photo damage, helps clear out the old damaged skin cells and products and proteins in the skin that result from sun damage and years of actinic damage. So it also stimulates, when I say in with the new, stimulates more collagen, more elastin, increased cellular renewal. So out with the old, in with the new, and then it provides a protection against the newly formed skin proteins and enzymes and cells, and it just basically will help promote protection of these new proteins that are being induced to be synthesized. So I really like this product a lot. And then just overall advice for, you know, body care. You know, there's lots of different treatments, and I can do a whole different video on this. Treatments, tightening devices, lasers that we can do on the hands, the chest, even the booty, the legs, and different therapies, including like Sculptra. Sculptra is polylactic acid, and it's suspended in the solution, and you can inject it into the booty to increase volume and to help with cellulite and a more smooth contour. You can inject it into the legs. You can blend Radiesse, which is it's a calcium hydroxyapatite, which is a certain type of filler that you can suspend in a solution and mix and put into the arms to help stimulate collagen in those areas. There's a lot of things that we can do for body contouring, and I want to kind of just stick to the products. But last but not least, I wanted to talk about shaving. So when you're shaving your legs, hopefully you have laser hair removal, but if you haven't and you shave your legs, it's always best to use a razor with less amount of blades on it. Now, the ones that are really the best to use and the most fun to use in the shower often has a lot of blades, but it's important to replace the head of the razor very regularly, because in between the blades of the razor can harbor bacteria, yeast, fungus, and it can cause a folliculitis, which is inflammation of the hair follicle. So dermatologists, I remember all throughout residency, they'd always teach us to tell our patients to use the single blade razors, but those are always like the cheap disposable ones that make you cut yourself, and nobody likes that. So I think the happy medium is to get like a razor with maybe 3, maybe 4 blades, but not those ones with like 6 to 8 blades. There's way too much room for harboring bacteria and yeast and fungus that can be a nidus for infection if you shave your legs. So be careful to usually, and they always say to use disposable razors, but who wants to do that? Those usually aren't fun to use in the shower, not very soothing on the skin. Another tip that I have is that when I shave my legs, I actually shave with a body cream or a body lotion. So you can use shaving gel, or you can even use a cleanser, but I always find that it's more soothing for my skin to shave my legs with a lotion. So I'd even use like maybe the CeraVe cream, or I have an Aveeno oatmeal, Colodo oatmeal lotion that I shave my legs with. So I know that was just kind of random what I discussed just now, but hopefully these topical products and treatments for your body will be helpful to you, and you'll pay attention to the skin on your body, just maybe not as much as your face and neck and décolleté, but just give it a little TLC as well. Hope this helps you guys.